All right, we're going to take a look at the superficial face. This is a difficult dissection in the anatomy lab because, unlike other muscles, the muscles of facial expression, or mimetic muscles as they're called, arise from the bones of the skull but insert into the skin. That's why we're able to have the variety of facial expressions. So in dissecting them, when you remove the superficial tissues, you are actually cutting away a lot of the insertions. It makes the muscles difficult to see. So in this little model, we're going to look at some of the major muscles of facial expression. And remember that all of these muscles that we're talking about are derived from the mesoderm of the second branchial arch, and therefore are going to be innervated by branches of the facial nerve. So we start up here. Here's a small, sort of inconsequential muscle called procerus, and next to it is this muscle. There's a pair of these on one on either side. These are called the corrugator supercilia muscles, and they're the muscles that draw your eyebrows together. So when you're sort of either frowning or pondering something, it'll corrugate the skin above your nose. We also have here three major sphincters, and these are very important. Two orbicularis oculi muscles. Each orbicularis oculi muscle surrounds the eye and has two parts. Part that is attached to the skull, and that's called the orbital part because it is attached to the rim of the orbit, and a part that comprises a portion of the upper and lower eyelids, the palpebral portions. Orbicularis oculi muscles are particularly important because they are the efferent component of the blink reflex. So that when, if you can test this actually clinically by drawing a wisp of cotton across the cornea of the eye, and the patient will respond by blinking, and that will test the integrity of the facial nerve. The blink reflex is very important in protecting the eye because, as you notice, our eyes are continually moist. Orbicularis oculi, and blinking lays down a coating of tears over the eye each time we blink. Also, you notice that if you hear a loud sound, often you will close your eyes reflexly. Muscles are also for the purpose of protecting the eye. The orbicularis oris muscle is the muscle that surrounds the opening of the oral cavity, and it is partly incorporated in the upper and lower lips, and that has an important function in particularly in infants, in helping them to grasp onto the nipple during breastfeeding, but also in everyone else. When we eat, the orbicularis oris muscle compresses the lips against the teeth and prevents food from collecting between the lips and the teeth. Now there are additional muscles of facial expression that are seen here, and these are very difficult. Some of these are very difficult to see in the cadaver. This one here is one of my favorite muscles because it's the smallest muscle in the body with the biggest name. It's called the levator labii superioris aliqui nasi, and that's the muscle that will elevate the upper lip and also flare out the ali of the nose. So if you flare your nostrils while lifting your upper lip, that's the muscle called levator labii superioris. And if you're going to snarl at someone, you want to lift your upper lip, that's the muscle that you would use. We have two zygomaticus muscles because they attach to the zygomatic bone and insert into the orbicularis oris. The zygomaticus minor, which blends into the orbicularis oculi, and the zygomaticus major. Going out horizontally from the corner of the mouth is a small muscle called risorius. Inferiorly, we have a muscle that depresses the angle of the mouth, depressor anguli oris. So if you want to pull the corners of your mouth down in a frown, that's a muscle that you would use. In front of it is a muscle called the depressor labii inferioris that pulls down your lower lip, also contributes to frowning. And anteriorly on either side, two muscles called the mentalis muscles. And these are the muscles that dimple your chin when you're frowning. There's an old saying that says it takes more muscles to frown than it does to smile, and that's true because all of these muscles here and some of these up here would be involved in frowning, whereas if you smile, you're using largely your zygomaticus major and your risorium. Okay, so now we're going to turn a little bit so we can see the lateral view of this, and we're looking at the area that we call the parotid region because this area is filled with the large salivary gland called the parotid gland. The parotid gland fills in the space in front of the ear. Here is the external auditory meatus, so the external ear would be in this position here, and the parotid gland fills in that whole space. The duct of the parotid gland comes out of the anterior aspect of the parotid gland and travels to the buccinator muscle, another one of the important muscles of facial expression, where it pierces the buccinator to open into the oral cavity opposite the second upper molar tooth. The buccinator muscle, sometimes called the bugler's muscle, because if you fill your oral cavity with air and then close your glottis, you can puff out your cheeks, and that's a useful talent if you're a bugle player. Importantly, though, for us is that the buccinator, like orbicularis oris, compresses the cheeks against the teeth and prevents food from collecting between the teeth and the cheeks when we chew, keeping the food in the oral cavity. Again, for babies, it's important in creating the pressure, the negative pressure in the oral cavity for suckling and removing, getting milk from the mother's breast. Emerging from the anterior edge of the parotid gland are the main terminal branches of the facial nerve, the nerve which innervates all of this musculature. And we identify 5 principal branches of the facial nerve. Temporal, zygomatic. This also might be a zygomatic branch because it's going to the zygomatic muscles. Buccal, that goes to buccinator. Mandibular, 2 branches here, and a branch called cervical. And we have a mnemonic for remembering those: to Zanzibar by motor car, or 2 zebras bit my cookies, whichever you prefer. I'm going to try to remove the parotid gland without ripping off all the nerves. Call this region the bed of the parotid because it is the branches of the facial nerve actually pass through the substance of the parotid gland, so it's very difficult to find them, but I wanted to remove it to show the facial nerve emerging from the stylomastoid foramen before entering the face and dividing up into the branches that supply all of these muscles. Here's the mastoid foramen, a mastoid process, and in front of it would be the styloid process. This muscle here, sort of quadrangular shaped muscle, is one of the 4 muscles of mastication. It's called the masseter muscle, and we're going to see that on the other side. Now I want to turn to the other side and take a look at the muscles of mastication. And there are 4 pairs of these muscles. One of those is a large muscle at the side of the head, the temporalis muscle. And the temporalis muscle attaches to the coronoid process of the mandible. Attached to the zygomatic bone and to the ramus of the mandible is the masseter muscle, and I'm going to remove both of those muscles. Remember that these muscles are innervated by the mandibular division of the trigeminal nerve. To reveal two other muscles, actually you can only see one of the two other muscles. This muscle here, the lateral pterygoid, arises from the lateral pterygoid plate of the sphenoid bone and attaches to the neck of the mandible. This muscle pulls the mandible forward and aids in opening the mouth. And then inside, on this side, we can see the medial pterygoid muscle that arises from the pterygoid fossa of the pterygoid plate and attaches to the ramus of the mandible. The medial pterygoid muscles, of which there are two, produce side-to-side motion when we chew. Finally, I wanted to talk about the terminal branches of three divisions of the trigeminal nerve that provide cutaneous innervation to the skin in the face. Emerging from the superior edge of the orbit are the supraorbital and the supratrochlear nerves. The supratrochlear nerve is medial to the supraorbital, and these two nerves are terminal branches of the frontal nerve, which is one of the branches of the ophthalmic division of trigeminal nerve. Almost in line with the supraorbital nerve is a foramen on the inferior side of the orbit called the infraorbital foramen, and through which the infraorbital nerve emerges onto the face. The infraorbital nerve is a cutaneous terminal branch of the maxillary division of the trigeminal nerve. And almost in line with the infraorbital foramen is the mental foramen in the mandible, and the mental foramen transmits a cutaneous terminal branch of the inferior alveolar nerve, which is a branch of the mandibular division of trigeminal nerve. So each of the three divisions of the trigeminal nerve provide cutaneous branches for innervation of the skin in the face.